بسم الله الرحمن الرحيم. السلام عليكم جميعا. I hope this session will be very interactive and you can put any question on the chat. Any question is welcomed. And we're going to start at exactly 4 p.m. Cairo time. And we'll start by one of my presentation. I can see Dr. Mahmoud is present. It was his idea. And I hope that you will find this meeting to be of benefit. Let me share entire screen and share sound as well. Let us share and let us start PowerPoint presentation, and we can make it full screen. I hope that you all can see my screen. It is now 3 minutes to 4 o'clock. I would like to respect the time, so we will start in 3 minutes time.
بس يسار، بس عبت، بس يسار.
Okay. So, Bismillah ar-Rahman ar-Rahim. Welcome everyone. This meeting and this lecture is designed to be interactive. So, at any stage, if you have a questions, please put it on the chat and then I will right away take your questions. A lot of you have got either the results or got friends who went into the exam, or maybe have a question, what is my professionalism is being scored? How this can be scored by an examiner? How he give me a grade, how professional I am? Because I'm very professional. So this, we need to go to the system that explain this. Not only this, but why I did not pass MRCS because I've just missed 1 degree or 2 degrees. Is that fair? I should have passed. I have studied quite a lot. So the topic of my lecture is professionalism in MRCS Part B examination. My name is Dr. Muhammad Omar Farouk. I'm a consultant vascular surgeon and examiner of the Royal College of Surgeons of England. Now, the MRCS exam depend on OSCE exam, and OSCE depend on Miller chart. A Miller chart is a chart that you can see. We want to know that you know the information and you know how to apply it, and you know the skills and you know how to apply it. So this is basically what we are examining. It's not just information. You cannot pass this exam even if you are perfect in knowledge without showing how and skills. The basic idea of MRCS means that you are eligible to go to the MRCS higher surgical training to get an FRCS. So I have a question here that any questions? I'll go. Here is a link on the Facebook that been sent by Dr. Muhammad Mahmoud. I think maybe this link means that is broadcasted on the Facebook in this link, which will be very good idea. And thank you very much, Dr. Mahmoud. So what I want the candidate is to tell me I am a good doctor. I can take a job of ST2 or ST1. What is ST means? It means surgical training. And this in opposition to core training or CT. And we have CT1 and CT2. When you graduate, you go to CT1. Then you go to CT2. After that, you should have your MRCS. If you pass MRCS Part A, you have 7 years to get your MRCS Part B. And you have only 4 attempts. If you fail the 4th time, you cannot get MRCS. And the fees is now 1,132. So it is not low cost exam. It is actually quite expensive exam. I can hear a voice from one of the attendees. If you can mute your voice unless you have a question. Now here is an important slide, which about professionalism, which a lot of candidates say, how you get a grade about professionalism? In the exam, we get a paper which is called examiner instructions. And in examiner instruction, we have 4 type of grade. Grade for clinical knowledge. For example, you know the lymph node to the stomach or lymphatic drainage of the colon. This is clinical knowledge. Clinical and technical skills. This means you know how to examine an abdomen in a professional way. And this is skills. Communication, you can communicate clearly with the patient and with the examiner. And professionalism. Professionalism is an item related to the station that show me that you are professional. What are these items? Number 1, you have very good command of English. You cannot pass this exam if you have a bad accent, because the official language is English. You must have a good body language. When you speak to the patient, you're not bending like this. You're not speaking very slow. This is not a professional way. And you must have a system. Every station you go through, there is a system that you should do. For example, abdominal examination, you need to do 15 steps. We call it a checklist. So if you go to checklist abdominal examination and you don't stand in the middle after superficial palpation and look around, what shall I do next? This will lower your mark for professionalism quite a lot. Notice the examiner will be silent. We have instruction. Number 1, when you come to the room, we'll not shake hands with you. But if you volunteer to shake hands with us, we shake hands with you. This is because we have been trained by a course called Diversity and Equality course, which act as a regulator to our behavior. So when you go to the room, what is your number? We don't like to hear your name because your name reflects the religion background. So you said your number is 2022. Thank you very much. Here is your patient. Here is your suture or whatever. And please start. Otherwise, we stop communicating with you unless you do certain harm to the actor. For example, in cranial nerve examination, you start to take a cotton to test for corneal reflex. Here, the examiner will stop you, will not let you continue because here you put the actor in harm. Okay? So this is professionalism. If you have a 20 grades in each station, it is out of 20. There is no half mark. It's all full mark. Professionalism takes around 4 marks, clinical knowledge around 8, clinical skills around 4, and communication skills around 4. And they are collected. Here is anatomy of the cycle. You will have 17 active stations. So candidate who cannot study for a duration of 4 hours, by the time he reach halfway, which by now it's one and a half hour or 2 hours, he become exhausted. So you found very good performance in this part, but in the other part, he's exhausted. He just wants the day to go out. So I always advise candidate, please get 4 hours study cycle. Don't study 1 hour and then have a break and have coffee and watch TV. This doesn't work. You must study for 4 hours with full concentration. And you have between station 1, station 17, you will get 2 resting stations, not just one. And there is, instead of 1 minute, we put 1 minute to move between stations. Because sometimes in some of the hospital, moving between one room to another room sometimes takes 2 minutes. So this is being put in consideration. And you have 1 minute to read the instruction and 9 minutes for the task you are allocated to. And applied knowledge, it's 160-degree, and clinical skills is 180 degrees. Okay? And this is the both of them. You must pass both pillars. You cannot pass one of them and this, if you have more mark here, to cover the other one. No. And this is called the double look rule. The double look rule means that you must pass both knowledge and skills. You cannot just pass one. Now, communication skills are 4 stations. History taking, very difficult station. Giving information to patient relative. And this is also important because you will face a lot of scenario if you do not read General Medical Council guideline for professional behavior, which is around 30 pages. You will be unable to solve this. For example, if you have a patient and his daughter in ICU, she's brain dead, but she already have a donor card. How you can speak to the father to say his opinion about organ donation for his daughter? Unless you know the ethics, you will be unable to solve this station. And for this reason, I have created a program for that. Giving information to colleague, again, this will open a lot of your skills. Most of the candidates that I see from overseas countries like Egypt, India, and Pakistan, they are similar. They have a good knowledge, but they fail down in communication skills because it is not part of their practice and they haven't seen it before, and they probably have not read General Medical Council guideline on good practicing of medicine. Clinical skills, this is an easy part. 3 station, we don't use real patients anymore. We're only using actor from the COVID era. we don't bring a patient, and the stations of suturing and catheter station and so on. Okay, so here is the clinical knowledge you need to read, communication, and professionalism. This will test your judgment, your decision making, your limitation, and one of the most important is patient safety. This is extremely important. Now, marking system. Professionalism, you get 4 marks. Communication, you get 4. Skills, you get 8. Knowledge, you get 4. And here the total score is 20. And we have seen people getting 20 out of 20. They were good and they deserve it. And there is another way of assessing you, which either fail, borderline, or pass. Why this is not automatic by grade? If you get 20 out of 20, you're pass. Because both assess different things. The grades assess how you performed in this station. But maybe you have answered many questions correct, but you get to one question and you made a fatal mistake. This will make you fail even though you have answered a lot of questions correct. Give me an example. I will give you an example. The example station I remember very well, nasogastric tube station. Patient with nasogastric tube, I get you chest x-ray. The nasogastric tube is going into the right side of the chest, which means it is in the right lung, not in the stomach. And then I ask you, how do you know that this is nasogastric tube? How do you know that it is in the stomach? How do you measure the pH? And what situation do you put nasogastric? He can answer this all correctly. Okay? The last question is, the nurse asked you, shall I start feeding with this nasogastric tube, doctor? I got a candidate say yes. And this candidate can get 18 out of 20, but he will fail because in front of me, he caused aspiration pneumonia, patient is dead. So scores means measuring what you have done, but you still can be fail if you got a fatal mistake. So keep on your guard always during the exam. And this does not happen by accident. You must get training to go from the station, completely ignore what happened, even if you've done good or done bad, and concentrate on the next station. And this needs training because a lot of UK doctors from Birmingham University, from Edinburgh University, and so on, they got OSCE training from medical school year 1. So they know the system. But for a graduate, very good graduate from Ain Shams University, Qasr Al Aini, other private hospitals, they are very good doctor, but they don't know what is OSCE. It's the first time for them. And for this reason, I have created a platform to help you to get training. How can I do that? It's not just by inviting you a course, although we have a course in VAacademy, which is a mock exam, exactly like what happened in the exam with 17 stations. And then you book the course with an examiner and you know exactly what is your defect before you go to the exam. But I've also created an application for this. So I would like to show you this application and we'll see, you can see my screen. Here is the screen. I will go to this link. This is a program called Your Professionalism being tested. It is made by VAacademy, which is an AI agent. This is an artificial intelligence because I thought, well, how can I help a candidate for all of you to pass? Because you don't know how happy we are, all examiner, to see a good candidate. We remember when we were in your place and we were afraid of the exam and we were afraid of the examiner. And then they helped us across the way. And we like to help you. But the system is perfect. And the system, for you, you must have all the training skills. And really, I found a lot of candidates who have failed MRCS. They are not a bad doctor. They are really very good doctors. And they are really studied hard. But the system is new to them. So, professionalism. Number one, I put it into certain facts you need to know. And I got to test you as well. Someone would say, how can I get this program? It is on my YouTube channel called the Vascular Online Training. If you join membership, and then after you join membership, you go to courses. Actually, this program have costed me a lot. I'm actually losing by more candidates using it because I pay for what is called token, which is artificial intelligence plays the role of an examiner for you any day, any time of the day or the night. So I've actually got an examiner with you. And all the candidates that are using it, they like it very much. It helped them very much. And it is pretty accurate as well. And the cost is not more than, I think, around $2 per month. And I got a question here. I like to be interactive. So let me see these questions. Please, doctor, could you write down the link, please? Well, always, this is a good question. Easy. Go to YouTube and look for Vascular Online Training. This is a YouTube channel which is created for MRCS and FRCS. Okay? It is easy to be found. So here I will put in the reply, go to Vascular Online Training YouTube channel. Okay? Easy, straightforward, and all controlled by YouTube. So, number one, I will give you first information about professionalism. What examiner means by professionalism? So I've put you here points. This is what the examiner mean by professionalism. Because a lot of candidates say, why I failed this station? I was taking history perfect and the actor was smiling to me. No, we're testing something that you don't know. Professionalism is not just being polite. It's demonstrating a commitment to safety with ethics. Give me an example. If a patient tell you, I got an abdominal pain while I was in my daughter's wedding. If you don't say congratulations to your daughter's wedding, you lose a mark for empathy. I got another question. Again, I like to be interactive. So let me see. Oh, yes. Here is the link. It's been done by Dr. Mahmoud. Thank you very much, Dr. Mahmoud. And here you will have a package of online courses. I will show you how it works by now. Okay. So professionalism is not being polite. You must know empathy, honesty, integrity, what it means by honesty. For example, in the angry mother scenario, where is my son? You will say your son is in theater with my consultant. He's the best consultant in dealing with acute abdomen, and your son already left the theater. No, this is not honesty, because it's not in the scenario that the mother came to A&E and the child is still in the operating theater. Okay? Integrity is very important for the integrity. For example, if you have a patient with cancelled operation for the third time, you can tell the patient, I guarantee that your father will go to theater tomorrow and he will have his operation tomorrow. This is wrong. This is not honesty. because sometimes by tomorrow there will be no bed and he can have cancellation for the fourth time. So here I've put you the points. And once you read the points, you finish here. I put finish this module. Then marking system. I've put you here how to understand the marking system of professionalism. Red flag. Arguing with the patient. Don't argue with the patient or with the actor. Disseminating safety concern. For example, if you go to excision of biopsy and you don't see patient consent, then you're not safe. And we have a lot of problem with doctor doing this operation. I got another questions here. Okay, this question, let me see. I have joined Vasai YouTube channel, and when I open MRCS courses section, there's just a video. Can you please kindly guide me how to use Vasai Trainer? Yes, that's a good question. Go to Community tab, and you will find the link of all AI programs. With this link, if you go to Community tab, and let me give you an example. Here is the channel, okay? This is a video that will explain it, but if you go to Contents, okay? Contents, you'll go to Courses. This is the amount of courses I've made Vasai Professionalism Trainer, and I have so many courses for MRCS. So how can I find it? Easy. You will go to, I will show it here to you. You will go to, this is a YouTube channel. This is how you see it, YouTube channel. It will just open now. Yeah. And when you go to YouTube channel, go for membership. You're already a member. Okay. Once you're a member, go to read these post. You go to post. So you click on post, and here is the post. You will see the post I have sent. Here is the link, a great course for professionalism. You see this link? This link, which in post, all the AI artificial intelligence is through this link. And once you click on this link, you go into the course. So if I press here, then this is only member can access that. You'll see it will go to the link, allow your microphone access, okay? Then microphone access is allowed. And after that, it will open. Because this is a big program, it took me, I think, about 1 month to work on the code. It is done by Java code, HTML, and Python in order to help you to pass this station. Okay, so it is now opening the page. It is loading the program, and it is available any time of the day or night. Here is the program opened, and you can work on either your mobile, tablet, or laptop. Okay, so here the information, we said marking system. Okay, you know how marking is being done. Common mistakes. I've put a section about common mistakes because I have been examining for around 10 years. I have seen so many mistakes. Believe me, I know the candidate, the grade he will get after seeing him for 1 minute. I know how much he will score. I got another questions. Okay. Okay, let me see. Question. here. I got confused. Is there a way to go directly because it may step to reach AI? No, it is just a link. What do you mean a simpler step? It is just you click on a link, and this link opens the program. I wouldn't tell you how much difficult it is to make a program that sophisticated to be available with just one click on a link. So what do you mean it is difficult? It is not difficult, not confused, because you go to post and you press on the link in the post, not more. How much does it cost and how can I pay? It costs $2 per month and you pay through YouTube channel membership. There are 7 levels of membership. You go for membership with courses. So let us go to common mistake. Common mistake, argue with the patient. For example, when the patient tell you something and you start to argue with him, or blaming the nursing staff or colleague for a clinical error. For example, we get this many times when you get the son of a father who has been canceled 3 times. Say, well, I'm sorry, the nursing staff was not preparing things well for him. This is disaster. Overconfidence in performing procedure without proper. So overconfidence, sometimes we see it, that the operation is easy, we'll finish this operation in 10 minutes. This is overconfidence, and this is wrong as well. Here is another question. AI sometimes help us in practice, like we practice pathology, critical care. Yes, there is a program for surgical pathology, for surgical anatomy, for ATLS course, and for CRISP course as well. And I will show you how interactive it is, but I will need volunteer. I will need volunteers so you can listen to the patient and get the reply. Okay? So prepare yourself. If you are good volunteer, you can open your mic and then you can go. So here we still continue. There is what I call high score exam phrases. There is certain phrases that we like to hear it from you. Very good. Muhammad Ahmed. Okay, done. Dr. Muhammad Ahmed. He raised his hand. Okay, I will get you the first station. Get ready. So, empathy. For example, when you get a difficult situation, I can see this is very distressing to you, and I am here to help. Remember this sentence. You will use it a lot. Okay? Your safety is my priority. I will discuss this with my consultant immediately. Escalation. I have recognized that this is beyond my current level of expertise. Dangerous. Don't worry, it is nothing. This is fatal. Fatal when you say this. Or it wasn't my fault. Or it was the doctor before me's fault. This is catastrophic. Okay, so someone will say, well, this is too much regulation here. I got even the legal framework for MRCS, which is called MCA 2005. And this is the Mental Capacity Act 2005. You must read it very well. And I've summarized 5 important principles. But the beauty about AI, that this is not just reading. No, it is actual training. So let us get an angry patient scenario. Okay? You can select the level of difficulty. So level of difficulty is you got junior and you got senior and consultant. Let us take senior level. Okay? And here you will get the program giving you the scenario.
You are an orthopedic registrar. Mr. Jones's surgery was canceled for the 3rd time due to a bed shortage. His son is extremely angry in the hallway.
Okay, in this program, I didn't put time constraint because to use to explain it to you. I hope that you have heard the scenario well. Dr. Muhammad Ahmed, do you like to take this station? Open your voice. Dr. Muhammad?
Yes.
Yes, very good. I can hear you well. Are you ready to take this station? And don't be afraid. It is training. Don't worry about the course. And tell me
Okay.
what sentence you will say. This is the son of a patient who have cancelled operation 3 times. His name is Mr. Jones. What would you say to his son?
I would say, I know it's frustrating for you, but the situation is out of our hands, and we will. I can arrange a meeting with Mr. Mann if you want, but I can help you more if you tell me what do you want me to help you with.
Okay, I will show you your answer and then you can see the reply. I'm very sorry to hear about your father and what happened to your father for this cancellation. It's really out of my hand. And really, I would like to discuss with you how can I help you in this situation. When I stop, all this is being dictated and given to artificial intelligence. Now you will get 2 things. Examiner coaching. So examiner with you to tell you what you have done good, what you have done bad. And you will listen
Out
now
of your
to his son.
hands? That is exactly what the last person told us, and yet here we are again. My father is 80 years old. He's been fasting since midnight for the 3rd time this fortnight, and all you can say is that it's not your fault?
You see? This is the reply you will get, but the examiner. Now, this examiner feedback is a special AI that have resources from the Royal College, not from anything else. So as if you have an examiner with you. It tell you, stop being defensive. Validate his anger immediately and take professional responsibility for the system failure. So a lot of you doesn't know what to do in this station. Shall I say, I'm really sorry. It's not my fault. I will try again tomorrow. No, you need to say you are right. We have failed your father 3 times. So you recognize the mistake. And then you put a plan, what you're going to do. And don't put in the plan overconfidence. So, Dr. Muhammad, it is now back to you. And when you have a reply, give me maximum 2 or 3 sentences, not more. And this is one of the skills that you need to take. And forget about 6 minutes. I want you to tell me how you perform this station. So, what do you want to reply to his son after what he said?
Yes, you are
Yes, Dr.
right.
Muhammad.
Yes, you are right. We failed with your father, but we can discuss it now and we can figure a plan that we're gonna going through it.
Okay. It seems that you don't know the plan. Okay. But I will put your answer to the scenario. I am really sorry for Mr. John. We have failed your father 3 times. I apologize for that, but we can together put a plan to solve this. And I will send it. Now here you will get 2 things. Examiner feedback, and then you get a reply from his son because you did not put a plan. Validate the anger first, you done that. But you did
I
not put.
appreciate you admitting you failed him, but words don't get him into an operating theater.
Yeah.
What exactly is this plan going to do differently this time to make sure he isn't sent home again?
Yeah, you see, it's very practical. And remember this, all the actors in the Royal College are trained uh, by 2 persons, very dear friend of mine. And they really train them well. And they are actor. I remember one of the actor in the exam was in Netflix series. So they are professional actor. When they play the role of angry mother, it's really angry mother. Or angry son, it's really angry son. And really what he's saying is logic. So, Dr. Muhammad, what is your plan if a patient cancels 3 times? What you're going to do?
We're gonna put him as a priority, and I will discuss it with my team, and we will put your father as our priority for the next operation.
Okay. Even if this operation tomorrow, he will come to you. What if it is canceled like last time? I will tell you the answer. You need this. This station want to know what is your plan of action. So what you would say, I will speak to the hospital manager right after I finish talking with you, and we'll see the bed situation, and I will speak to the head nurse to make sure that we do all we can for his operation not to be cancelled. Here, you put a plan, something you will do, but not you and the son will do this because say, you are the doctor, it's not me. And your father cancels 3 times. This is your job, not my job. So you cannot blame the son for this. And a lot of you, because you probably have not practiced in UK, there is a head nurse which arrange bed situation, anesthetic situation, and there is an emergency slot to put cases like that. So this is what a lot of candidate doesn't know. That is why in this station you can have a lot of conversation, but you're not going anywhere. So you said, can you tell me what your reply will be, Dr. Muhammad?
All right, I will arrange with the bed manager,
Yeah.
and we will put your father as a priority for our tomorrow list.
Excellent. Okay. Now you're talking. Okay. Okay. I will speak to the head manager of the bed situation and the head nurse, and I, with my consultant, will make sure that he is very high priority for us, for your father to go to theater next available list. Send. All what I've said is dictated. Go into the machine. Now the AI will get you a reply from the candidate and examiner feedback. Boys apologize sincerely first. The news professional
The
title.
next available list? That is the same vague promise we've heard twice before. I want a specific date and a guarantee. If there are no beds here, why aren't you transferring him to a hospital that actually has room to treat him?
You see, and this is level intermediate difficulty. I didn't get you the difficult one. So what do you reply to this, Dr. Muhammad? Why you don't transfer my father to another hospital? And the last doctor have told us the same. Can you guarantee he's going to have an operation tomorrow?
I cannot guarantee that he will have
Yes.
an operation tomorrow, but I
Yes.
will reassure you that if we transfer him, he will under the process of re-evaluation, and it will take times. And so I need to be patient with me, and we all here to help your father get his operation done.
Very good. Very good. I like from you, number one, you did not give any vague promise. I guarantee your father will have an operation today. This you will fail. And you did apply alternative. Obviously, you don't want to transfer the hospital to another hospital because this means hospital have failed him. So you try to catch up as much as you can. So I got someone raise his hand, Sharif Ali Shirbini, and another one raised his hand. Sharif Shirbini probably raised his hand for a question. Do you like to unmute yourself and ask the question? Dr. Sharif?
Is it
أهلا يا دكتور، مع حضرتك يا دكتور، ازي حضرتك؟
الله يسلمك.
أنا حاولت دلوقتي إن أنا أدخل على التشانل عشان نوصل لل AI application زي ما حضرتك قلت، بس هي في حاجة مثلا إحنا مش عارفين نوصل لها، فحاولت يعني، فلو في instruction أسهل نوصل لها directly يعني.
سهلة قوي. Are you a member of the channel?
I just joined the channel.
You joined the channel. What level of membership did you join? There are 7
هي
levels.
I just يعني عملت سبسكرايب وبعد كده دخلت الفيزيت كوميونتي، وأول ما دخلت على الفيزيت كوميونتي مش طلع لي إلا البوست بتاع امبارح اللي هو المرسوم عليه واي فازا من MRCS كورس، واللي فيه كده مكتوب عليه حبة انستراكشن. بعد كده اللي بعديها البوست اللي بعديها من 1 month مش باين الباقي.
You have not joined membership for courses. There are 7 level of membership. The artificial intelligence at level 7, 4 courses, and you must know which level. You probably have joined the level just to be a member. And if you are just a
طب
member, you will not have access to this AI.
طب membership فتحتها الجوين، كان في ايكون اسمها جوين مكتوب فيها mentorship. see the recent video first, got
أيوة
vote,
أيوة
CME certificate, career advice,
آخر واحدة with courses.
access vote courses.
أيوة هي دي. This is the one that will
Yeah.
give you access. Because this is
Okay,
AI
but
courses. These courses take from me something like £500 per month, 500 British pound per month, in order to get you an examiner and a patient free of charge 24/7. So I just want you all to pass the exam, and I want you to be as good as any UK graduate and to have the highest score. Now I got SCW. He have raised his hand, and you can ask your question.
سؤال أخير قبل ما أقفل
اتفضل دكتور
معلش.
شربيني.
دلوقتي حضرتك بعد ما هعمل جوين للكورسز هيطلع لي الأكسس على عبارة عن هيئة لينك ولا هيطلع لي على هيئة إيه؟
أول ما أنت you join member in courses, then you will get post which is being sent to people member for courses only, and this will not open unless you join that level of membership.
طيب أنا هعمل جوين وأرجع لحضرتك عم حضرتك تخلص.
It's easy وإن عندي ناس كتيرة موجودين فيها، وبسم الله ما شاء الله نسبة النجاح لدرجة إن البرنامج ده بيديله نسبة النجاح اللي هو هياخدها في الامتحان. I was impressed خاصة من الناس اللي نجحوا قريب. Anyway, SCW, go ahead with your question.
Thank you, sir. First of all, I would like to thank you again, and this is one of the best practice I've seen while
Okay.
I have prepared in next month. Sir, can we just practice one station from this
Yes.
beautiful application from the critical care or patho or whatever you choose, if you don't mind?
Yeah, I don't mind. So you want to volunteer for a station, is that right?
Yeah.
Yes, excellent. You are the next one. And Dr. Mahmoud Abu Naga. Mahmoud Abu Naga have a question. So our next
دكتور محمد
candidate
ازي
will be
حضرتك يا فندم؟
SCW. Okay.
دكتور محمد ازيك يا فندم؟
الله يسلمك، ازي حضرتك؟
لو سمحت، الحمد لله بخير. لو سمحت، انا حاولت اشترك قبل كده وحاولت ادفع بالفيزا بتاعتي، كان في مشكله في الدفع وما عرفتش اوصل. هل دي مشكله في الفيزا ولا هو بيحتاج كريدت كارد معينه
No,
ولا ايه؟
there
عشان
was
بس
a
ما عرفتش.
problem with Egyptian visa, international problem, but now there is not a problem at all. And
يعني فيزا
YouTube
المرتب عادي اللي
is the
بنعمل
biggest.
بيها دي عادي؟
Yeah. YouTube is the biggest to take visa, so it's no problem at
انا
all.
اسف على المقاطعه يا بروف، اسف على
اتفضل.
المقاطعه. وبخصوص الاشتراك هنا في مصر على اليوتيوب بيكون من كريدت كارد بس، كريدت كارد فيزا او ماستر كارد، انما فيزا
ممتاز.
تقدر
المرتب
تساعدنا بقى يا
وفلوس
دكتور
الفيزا لا.
محمود؟ تقدر تساعدنا بقى يا دكتور محمود؟
طب بعد الميتنج ماشي ان شاء الله.
طيب خلاص تمام، مش مشكله. شكرا دكتور محمد. شكرا دكتور
Excellent.
محمد.
لا، العفو. Any question you are very welcome. Okay.
عذرا على المقاطعه يا بروف.
لا مفيش مقاطعة. أعرفكم دكتور محمود معانا في الفي أكاديمي تيم، وفكرة الميتنج بتاع النهاردة هي فكرته عشان تدسكاس بروفيشناليزم. وتحب تقول كلمة يا دكتور محمود؟
شكرا جدا لحضرتك يا بروف. انا طبعا يعني الغرض الاساسي نساعد الزملاء وكلهم ان شاء الله ينجحوا في الامتحان وبسكور عالي، وطبعا يعني باذن الله يعني تكون السكورز اعلى سكور في الميدل ايست كلها ان شاء الله، يعني المصريين بالذات. شكرا جدا لحضرتك.
العفو العفو يا دكتور محمود، ان شاء الله ودي حاجه تسعدني. ان شاء الله ان انتوا تبقوا من الاوائل وتاخدوا هاروتس برايز. لو ما تعرفوش هاروتس برايز دي عباره عن دكتوره انجليزيه خدت سكور 20 من 20 في كل الستيشن. بصوا بقى هنا دكتور محمد احمد، انت موجود معايا؟
ايوه انا موجود.
اوكي فيري جود. I've finished the station. خد بالك. And this is your global score 5. But this is not the benefit. It tell you communication you took 4 out of 10. Professionalism 5 out of 10. Management to leadership 6 out of 10. You're actually performing good. Here is the golden standard reply. يبقى ناس كتيرة بيقولوا لي في الامتحان طيب أبوه اتلغى 3 مرات الليستة. What shall I do? He doesn't know what is the answer. Now listen carefully to this answer. I am absolutely devastated to tell you this, but we cannot proceed with your father's surgery today. He's devastated. You share him. I know this is third time, and I completely understand your anger. So accept his anger. This is very important. We have failed him. Don't worry. If you say this, you take the anger of the patient. And that is unacceptable. First, please let me get your father some food and the tea immediately. Oh, this is fantastic. You see communication skills? Can I get your father some food or tea? Do you like to have a cup of tea? In the middle of conversation. As he has been fasting unnecessarily. You forget that his father is fasting. Regarding the plan, I'm not just putting him on the next list. Listen to this. This is the best reply. I am flagging this as a critical clinical incident. I will personally speak to the medical director and the bed manager and advocate that surgery for him. You see the reply? And not only this, but it will tell you that you were good at 3 points and you were need to improve in 3 points. Let us see. You were good in accepting institutional responsibility. You remember when you said we failed you? This is a strong point. Correctly identified. I remember one of the Egyptian doctor, he said, I will complain to the head manager. And obviously he failed. Because you are one of the system, you should defend the system. Correctly identify necessary stakeholder to involve resolution. You mentioned bid manager, this was a good point. And you remained calm in the face of aggression. Now, this have costed me a lot because artificial intelligence not just reply to you, but I put emotions in the scenario. So he reply with anger. And this is an expensive AI model, but I want to give you the best model. Believe me, after you do this station and you finish it and you know what you should have done, and then at the end you go have another trial, another again. You found your score increase from 5, 7, 11, 20 because you already trained. So I got SCW and he's eager to have another station. Let us give him a station of they are all really difficult ones. Let us say consent refusal.
Sir, can we just try one from the knowledge part? Like I've seen that this
Oh, yes,
is
here is the knowledge. Which one do you like from the knowledge?
Sir,
A 75-year-old patient with an acute abdomen requires emergency surgery but is refusing. You need to assess capacity and explain the risks.
Don't worry about this. So, which station do you want SCW?
Sir, from knowledge
This is
part,
a curriculum,
from pathology,
and this is a scenario.
from critical case.
The curriculum is not cases. This is information I've made to you. Do you know what is a SPAR system and the spike
Yes,
system?
I do know, sir.
You do. Very good. You're a very good candidate. So if you want to train a station, here is the station. Angry relative, consent refusal, post-operative error, formal complaint, um, dinar, which not fit for resuscitation, confidentiality breach, discharge against advice. Which one do you like?
Sir, I can do any, but I was requesting you for one station from the knowledge part. Is there any option like we can attempt pathology station, or we can
Yeah,
attempt one
yeah,
station
but
from
this is, I
critical
will
care?
go to another program called surgical pathology. So I'll tell you what I
Okay.
can do. We'll finish this program and the
Okay.
lecture, and then I will
Okay.
open surgical pathology to you and you select the station. Is that okay with you?
Sir, okay. Perfect. Perfect. Thank you.
Excellent, excellent. Here is a good candidate. He knows bar system, spike system model, and he have used to many patients. Okay, so I've showed you how the system works. Let us go back again to the lecture. And it is this one. Okay. And we mentioned this, that you can have failure. Now, grades. How grade is being done? And why I failed? Because just one grade. I got six questions. Let me take them right away. Here is a questions. 6 questions. Okay. So first one, can we try one of the difficult one, just a few sentences? Yes, you can, no problem. SCW. But you want knowledge. But
Yeah, I requested it before
you
when
requested it before.
the
No
other
problem.
colleague doctor was practicing, but now I
Oh,
have got the idea. It is excellent, excellent one.
yeah.
We
Okay.
will go to the knowledge part.
I
Yeah,
tell you one thing. No
yeah.
one have used my AI program more than 30 hours and failed. No one. It is as simple as that. And another, can we just practice now? Yes, you can. And I can give you critical care. I can give you one of crisp cases. No problem at all. And credit card in Egypt, Dr. Mahmoud answers that. Is this lecture recorded? Yes, it is recorded, and we'll put it on the YouTube channel. And Dr. Abdul Min'am, sir, I have joined the course level, but I have difficulty to open the link for history taking program. Even I am using update Google Chrome. Could you help me? Yes, I can help you very much. And just send me time that you are free, and then we can make a Zoom, and then I can show you how it works. Because you need to have laptop, updated software, use Google Chrome, and connect with AI Studio to your Google Drive, and then the link will work perfectly. No problem at all. So now there are another 2 questions. Is it recorded? Yes, it is recorded. And نتيجتي فعلا في communication skills. Yes, I tell you, you are a good doctor, but we have not been trained for communication. And that's as simple as that. And this new software train you for this guard. So now grades. You know why you get your success or failure on the same day? Because all your grades are being documented by all examiner. It's been recorded, uploaded to the Royal College server on the same day. Does anyone know why you don't know the result on the same day? If anyone have the answer, you can unmute yourself. Okay, I tell you the answer. The answer is that the Royal College get your grades after a cycle of 4 countries. So after London exam, New Delhi exam, Cairo exam, and Sri Lanka exam, you get all the 4 of them, and then you see which station they have performed and what are their grades, and then you get your result marking. So someone would say, if I go to Sri Lanka, the exam will be easy. I will pass straight away. This is completely wrong. If I go to London, I will be competing with British graduate. It's difficult to pass. Completely wrong. If you go to Sri Lanka, go to London, it is equal. Both are the same. And I will give you here the passing mark. This is not a confidential information. This is a passing mark from ICBSE, which is the authorities that control the MRCS exam, which is Intercollegiate Fellowship, Intercollegiate Basic Surgical Education. Okay. Now look at the pass rate. This is May 2023, 700 candidates, 60%. October 23 and 56%. February 24, 60%. Total 59%. Now, the exam, you always get passing mark around 60%. If you all are very good, 60% will pass. If you're all very bad, 60% will pass. And these are the best 60%. So this is the way how grading is being done. Okay? And this is really a good news for you, because if 10 people go for MRCS exam, 6 of you will pass the first time. Okay? And I am sure of actually, when I started to do these courses, I actually raised the bar for passing the exam. Someone would say, what do you mean? I mean that your level who took VAacademy courses and joined the AI, which hopefully will get it into our online platform, hopefully soon, you become very good. You become excellent. And when you go to the exam, your level is very high. But not all of you will pass. Still 60% will pass. But the passing mark is quite raised, quite high. Okay? So this is how marking is done. And this is another exam also. 60%, 56, 62, 59. As you can see, these are the mark. And here are some example of the stations that is there. Okay? I've here explained also some of the station, but I know a lot of you are interested in using this artificial intelligence. So let me go back to what we were discussing. SCW want to have a case with surgical anatomy or something critical. So we'll see that. Let me go to my Google Chrome. Okay. And then I will go to my program. Here it is. Okay. And then I will go to this program. So SCW, you can speak now. I will tell you
Yes.
what program I have, okay? And then you can choose. I have the following. Okay. These are programs for FRCS, no, not MRCS. Here is surgical anatomy, Vasai surgical anatomy trainer. Here is medical interview trainer, because I want to train you how you go to interview to reply very well to get the job, because competition will be high after prioritization bill, and how to enhance your CV, and surgical pathology trainer. And you can have prediction tool. You can predict from machine learning what will come to your exam, which station will come. And this is by using machine learning. So if you're going for April, it will tell you what common station will come in April. This is not a cheating, it's just using machine learning in the last 10 years from the Royal College exam. How can I get what happened in the exam? Because I have an access to Telegram groups, which is formed after the exam, and then I can know which station will come. And you can have communication skills trainer, or you can have ATLS trainer or CRISP trainer. Which one do you like?
Station
SW.
from critical care.
Critical care. Okay. CRISP trainer. Very good. We'll get you one station to get the flavor. And here it is. I will open the mic. Okay. And then here I will get the link, copy, blah, blah, blah. And here, once you copy the link, you put it on your browser, Google Chrome, then it will open the program. Okay. And then allow microphone access because you will be speaking. Now it is going into the database of this CRISP, and then I will get you a critical case and we'll see how you perform. What do you think your score will be, Dr. SW?
Sir, depend the what station shows up.
That's all right. Say I will get 20.
Inshallah, I'll get.
Inshallah, very good. This is what we want. This is our target. This is the target. Okay. Okay, here it is. So this is the program for VACI performance analysis. This is the critical care of surgically ill patients. Okay. Now here you will get the scenario. Here is a septic surgical patient. Okay. This one is allocated to time. So here we will have time. So let me get surgical patient. First, you will hear the scenario. Now it is going to the AI. Here is the scenario. Not only this, but it will say the scenarios for you. So SW, concentrate. This is your case. You can read or you can listen. You need to wait a little bit for the
Doctor,
voice to
I'm
work.
glad you've arrived. I'm looking after Mr. Arthur Miller in bed 4. He is 68 years old and is currently day 3 post-op following a laparoscopic anterior resection for rectal cancer. He was doing well yesterday, but over the last 2 hours, he's become increasingly agitated and confused. His skin feels very hot to the touch, and I've noticed his catheter bag has only 10 milliliters of dark urine from the last 2 hours. I'm quite worried about him. Now, examiner feedback. A good start. You have been presented with a high-risk surgical patient, News 2 of 9, on post-op day 3. In CCRISP, POD3 is a red flag period for major complications such as anastomotic leaks or significant infectious sources, SSI, VAP, or UTI. Your priority here must be a systematic ABCDE assessment. Note the tachycardia, tachypnea, and oliguria. These are early physiological markers of compensated shock, likely septic in origin. Ensure you communicate your initial assessment plan clearly.
Pause. Now here, you got the scenario. It is up there.
Yes.
This is the scenario. Okay. And then you get the examiner feedback. Not only this, but you get a monitor as well. Now someone would say, how this case can come in the exam? It can come. I can get you a chart, Muse chart.
Yes, I'm noting things down. It's post-op day 3.
Yes.
Along with it, anastomotic leak.
Yeah.
And significant infectious source.
Yeah.
Along with tachycardia. Oliguria.
So what you will do to this situation?
Sir, just a minute. I'll physiological markers, compensate shock, likely septic, ensure that GCMO. Okay. So I should give my answer?
Yes, give me answer. I stopped the watch because you can see here it is designed for 9 minutes station, but because I have a discussion with you, I stopped it. But we can resume anytime. So tell me what you will do.
So I'll be managing the patient as per CCRIS protocol following the ABCDE approach. And
Yeah.
first of all, I'll take a thorough history along with the clinical examination of the patient to confirm generalized peritonitis sign and
No,
symptoms.
you
Along
don't
with
take a
that,
history. You don't take a history. If you have this
okay,
scenario, you go to A, B, C, D, E, but you don't take a history
okay, I
because
was
this
coming to
patient,
this.
yeah. Okay. So
I thought that it is about management plan.
yeah,
So that's all.
management plan. Yes,
Okay.
you tell me that you check airway, you check breathing, and you go with A, B, C, D, E, and you get two large bore cannulas,
Okay.
and okay, but you don't take
I
history.
can restart.
Okay, so I will say what you say to me. You will do A, B, C, D, E. What after that?
Yes. After that, I'll do fast scan a chest ray as well to confirm the peritonitis, and I'll be arranging
First
operation
scan with
theater after
ultrasound, you mean?
consultation with, yes,
Yeah, okay.
to
So,
see the free fluid in the abdomen.
yeah, okay. So,
And then I'll be consulting with my senior anesthetist there to book the operation theater, as well as I'll be telling about the status of the patient, and I'll arrange operation theater of urgent surgical management of this patient. Along with that,
do you know what is sepsis 6?
yeah, I'll be before sending to the operation theater or before surgical management, I'll
Yeah,
start sepsis 6 protocol, which is
yeah,
I'll give patient IV antibiotics. I'll
yeah.
give patient IV fluids, warm crystallites
Okay,
solution to the patient, and then I'll pass Foley's catheter to assess the urine output. I'll take
okay,
culture. Along with
yeah.
that, I'll take blood
Okay.
samples at the
So
bedside, and
just leave speak to my consultant and end because in CRISP I want to know how you can deal with such very critically ill surgical patient. I'm not asking you that you will tell consultant. So I want you to know
okay,
ABCDE. You want to know immediate management.
okay,
I want to know that you know sepsis 6. So let us resume. I will
okay, sir.
do I will do A, B, C, D, E. I will check his airway, his breathing. I will put two large cannula and monitor his urine output and do fast scan for his abdomen. Now you
Okay,
get a reply. You can see all of that is being written. It's been sent to the AI. The AI will get you the reply.
okay,
And the reply will be read loud for you. And not only this, but you'll find that the monitor is going with the scenario. So he's getting more tachycardic and he's more hypotensive. Okay. It is now being generating the sound.
I've got the high flow oxygen mask ready, doctor. I'm putting him on 15 liters via a non rebreather now. His airway seems clear as he's shouting and trying to get out of bed, but he's not making much sense. I'll help you with those two large bore cannulas. Which fluid should I hang? I've also got the blood bottles and the VBG syringe ready. He's looking much more pale and sweaty now. Now, examiner feedback. Doctor, you correctly identified the need for a systematic ABCDE approach, which is the cornerstone of CCIRSP. However, your response was a bit disorganized. In an exam or a real-life crisis, you must prioritize life-saving interventions alongside your assessment. 1. Airway. You noted it, but given his confusion, reduced GCS, or agitation, you must explicitly confirm if he is protecting his airway. 2. Breathing. With an RR of 26 and SpO2 of 93%, high flow oxygen, 15 liters, NRB, should have been your very first action. 3. Circulation. You mentioned cannulas, which is excellent. However, with a BP of 104.62, now dropping to 98.58, and oliguria, he is in distributive septic shock. You must immediately order a fluid bolus, e.g. 500 ml of balanced crystalloid, and start the sepsis 6. 4. Disability. Confusion in a post-op patient is hypoxia or sepsis until proven otherwise. Check a capillary blood glucose. 5. Assessment. You mentioned a FAST scan. While FAST is for trauma, in this surgical context, you need a focused abdominal examination to look for signs of peritonitis, anastomotic leak, and likely a CT abdomen pelvis later. Next steps. You have the IV access. What bloods are you sending? What is your immediate fluid resuscitation plan? And what specific physical examination findings are you looking for to rule out a surgical catastrophe?
So, what do you say about this reply, Dr. SW?
This is good though, but if I'll be giving answer like this much detail, maybe I'll not be able to complete station though. I think it is.
No, it actually concentrate on priority. We should say
Yeah.
that we'll give oxygen 15 liter per minute
Yes.
immediately. It is true. And we should two large bore cannulas and urine output and start resuscitation. We continue. It gives you the nurse feedback and the examiner feedback to correct your reply. So when you redo the station again, you will find yourself
Mhm.
so much better.
Okay, I can try this answer. Can I just try this particular question to answer once again? I have.
Yeah,
I
so
came
what
to know
would you
that.
say?
Yes.
So what is your answer now? Shall I put in the
So
system?
my answer here, I'll be managing the patient as per CCRIS protocol following the ABCD approach. First of all, I'll assess the patient airway. I'll assure that the patient airway is able to maintain airway. If not, then I'll be securing airway or the new adjunts to the
Yeah,
airway.
but
If
you cannot, this is what
I'll
you
be
said
giving
in the first question. Now
then I'll
remember,
be giving
yeah,
patient high flow oxygen with
yeah,
non-breathe mask of 15 liters, and I'll attach the saturation probe to assess the
yeah.
response to it, and then I'll pass two white bore IV lines, and I'll be
Here's the
with
nurse. The
blood
nurse will tell
samples,
you which fluid should I hang. So what
and then
fluid
I'll
would you
be
give?
giving fluids of 500 milliliters in 15 minutes of warmed crystalline solutions,
Yeah,
and then I'll pass the Foley's catheter to assess the urine output. Moving on,
yeah.
uh, I'll quickly assess patient's GCS, and I'll be checking the patient pupils and the neurological status of the patient. And then I'll moving on to the exposure. I'll quickly expose the patient, keeping the normothermia there. To do the primary survey, and if there is any significant finding to
Okay. You
confirm
have,
my.
yeah, you have a good information about CRISP protocol, but because you're not trained to apply it or implement it, you need to concentrate
Yeah.
on the sequence of event. You have all the
Yeah.
knowledge, but the knowledge is little bit here, little bit there, not let us say not run in a stepwise manner. But you got plenty of station, you got electrolyte imbalance station, epidural complication, and so on. And believe me, you get the score. Now you get 16.5 out of 20, and it follow your score across the practice over the week. So it's one of the best to train you about CRISP station. How CRISP can come in the exam? It can come by patient that is tachycardic, hypotensive, and patient is lying in bed with dressing. He had an abdominal resection um, 1 week ago, and this is the situation. Here, you don't continue examination, you go to CRISP right away. And there is another scenario of
Yeah.
PE. Scenario of PE. Someone post-operative 5 days with DVT in his leg, and here, and he's getting tachypnic, hypoxic, and there is an oxygen mask beside him, then you need to apply scenario for PE. But you have a good knowledge, you just need training how to implement it.
Yeah.
So that's but very good, SW, good score. Let me
Thank you.
see, I got
Thank
3
you.
questions. Here is a question. دي نتيجتي وفعلا كانت communication. Okay, you will improve. My advice, book the exam the next available slot. Your level is good. Get a good
Sir,
training about
I
communication.
have it's been good.
Sorry?
Yeah, it is in good 50 days from now.
50 days, that's plenty. Plenty. Study 8 hours per day over 2 cycles. Each one is 4 hours. So when the time of the exam, you already used to 4-hour study and 4-hour concentration. مش عارف افرق بين الكوميونيكيشن والبروفيشناليزم. Okay, it's a good question. Communication, how you communicate with the patient, with the doctor, with an examiner. Actually, every station of MRCS has a communication skills, even for suture station, because you communicate with the examiner. Professionalism. If you can imagine a doctor measuring blood pressure, okay? Not a Doppler, nothing at all, just blood pressure. See how he wrapped the cuff around the arm. He put the stethoscope on the right place. He does not repeat step twice. This is not communication. This is professionalism. If you cannot know the difference between communication and professionalism, there is a big problem. There is a big problem. Because communication is a way of communicate, and you must know a SPAR system, and you must know a spikes system. And you must read books about communication. And in my courses, I have collected the best 20 books all over the world for MRCS. So go to communication skills book and read it. Professionalism, how professional you are. In every step you do, you want to convince me as an examiner, I am professional. I can be on call tomorrow in London, and you have nothing to worry about. This is professionalism. You remember the steps you're doing abdominal examination. You don't stop in the middle, what is next? You do it professional way. You do it in a competent way. You have a competent English language. When you speak to the patient, good morning, Mr. John Smith, can I call you John? Is that all right with you? This is professionalism. So my reply, how can I know communication professionalism? Read about them. And then you will know what is communication, what's professionalism. And I have 2 AI programs that will solve this problem. One for communication, one for professionalism. Will there be any effect on total number of MRCS candidate appraising or the result of MRCS after this new prioritization bill? I don't know what is appraising, but yes, after prioritization bill, getting job will be more difficult. So they give priority to UK graduate to get the job, both training job and service job, both of them. But there are around 33,000 jobs per year, and there is around 50,000 doctors apply for them. So there are more applicants than jobs available. But if you pass MRCS, you prepare your CV well, you do your interview well, and there wasn't UK graduate apply with you because he will get the job before you, definitely you will pass. So will it affect MRCS? Yes. We think that candidate going for MRCS will decrease. Same with the BLAB. BLAB candidate will also be decreased. And this is answer question OB. And fast scan, doctor, yes, fast scan. Elbdan AM. Please, doctor, if you can answer me, fast scan for trauma only or can be used in any other condition? Obviously, it can be used for any other condition. Fast scan is one of the skills that you should be available to apply it in the acute setting and in the chronic settings. It is just how to use ultrasound with an abdomen to diagnose intra-abdominal bleeding, to diagnose cholecystitis, and to diagnose bladder full of urine. So yes, it can be applied acute and the chronic. It's not just acute. And one of the skills that you should need. So thank you very much for your time. And I really wish you all pass the exam with the highest grade. And now you don't have an excuse. I did not know the exam. I did not know my level. I did not know he will ask me this. I would not know that this station can come. No, everything is available for you. The choice to pass or not to pass is in your hand. And you have all the facility to pass the exam. Thank you very much for your time. I will record this teaching session and follow me on Telegram or YouTube station. And you can speak to Dr. Mahmoud or to me if you want to have a course in VAacademy course or to have an online course from the online services that we offer. We welcome you all. And we have one of the very high passing mark in our courses, which really makes me very happy. Do you like to add anything, Dr. Mahmoud?
شكرا لحضرتك يا بروف، شكرا جدا، بالتوفيق للجميع إن شاء الله.
Okay. Thank you very much and see you and congratulate you after you pass the exam, inshallah, very soon. With all my best wishes.
Sir, I do have a question if you do not mind, please.
Yes, please.
The station was allotted to me. Like, is there a full station, like a set of good 10 to 12 questions, and I'll be answering each question, or is it like one major stem and I'll be giving answer to it? In the
Yes,
knowledge
there is. Yes, there is. There is sometimes a station with 12 question or 20 question. Example,
Okay.
anatomy, posterior cranial fossa, foramen.
Mhm.
This station have at least 20 question. What is that foramen? Foramen spinosum. What will pass through foramen spinosum? And so on. And sometime you get few questions, so you have all the variety. Long question, but what is fixed is 9 minutes. So you have either 9 minutes question and answer, or 6 minutes to do task, and 3 minutes with the examiner. And this 9 minutes does not change. But what it changes is which station you will get. Does this answer your question?
Yes, this does answer my question, but because I wanted to practice, I have exam on 2nd of April in
Okay, you have
Pakistan.
plenty of time to exam, to prepare yourself. No problem at all.
Sir, I would like if you can add anything. Like now, I am finishing pathology in critical care once again. I've read anatomy once, and I've done communication part as well. But I would like if you can add on any expert opinion and expertise from you. Like, how should I divide in the? I would like to finish one in this month and one in the next month. Like, I would like to. I'm trying to revise it again. But if you can add anything that may accelerate how much maximum scores I
Yes.
can get.
I would advise you. Number one, get used to 6 minutes. Number
Okay.
two, always put 6 minutes in your time, in your mind. Do abdominal examination 6 minutes 100 times, even mentally in your brain. Do upper
Okay.
limb examination in 6 minutes. Lower limb examination, 6 minutes. Diabetic foot examination in 6 minutes. And when you go to the exam the night before, at least have 12 nights of sleep, 12 hours of sleep. And when you go,
Okay.
show me confidence from the way you come to the door. You want to show the
Okay.
examiner, I am competent. I am a very good candidate. Don't have weak body language. And if you done in station good or bad, once you go outside the room, completely ignore it. Concentrate on what is next. And I'm sure with your knowledge, you should pass, but sharpen your training. And now training can be done online with an examiner, with an actor, and the time is yours. You do whatever you like, and you will benefit quite a lot because it will tell you your mistakes.
Yeah.
And by training, you will ace this exam. It will become a piece of cake. And Dr. Sharif, he
Inshallah.
raised his hand.
Allah bless you. May Allah bless you, and may Allah
You're welcome.
accept this prayer of yours. Thank you.
Inshallah. And hopefully I will congratulate you to get a job in UK SCW, and hopefully we'll get you a job as well. So, Dr.
Yeah, thank
Sharif,
you.
you're welcome, Dr. Sharif.
Welcome back, Dr. Muhammad. I would ask again. I just applied your channel right now, and I have noticed there are many posts and there are many AI tools.
Yes,
also,
all yours.
That's also all of them are not any figure out which one is for me. It's for MRCS precisely, or what is?
Yes, I will
Easy
show
say
you.
that.
I've made a brochure. No, it's all right. It's all right because they are only. Let me share the screen again. Here is the screen. With voice share. I've put all MRCS. The name tell you what you need to this program does. Okay, so I will show you an image that I put all the MRCS. Do you have a paper and the pen?
Oh my! I have.
Okay, very good. Okay, let me tell you what courses will benefit you for the exam. Okay. Since you got paper and the pen, let me see. Okay. 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 Okay, here it is. Okay. Let me one drive. Okay. I will show you. Here it is. Screenshots. Number one, VAacademy Communication Skills Trainer. Okay.
مش مكتوبة كده في البوست.
ما انا
ممكن
بجمع
ابعت
لك.
لحضرتك سكرين شوت بقى اوري حضرتك
لا لا
المكتوبة
لا
ازاي.
لا
هي
لا لا.
مكتوبة.
انا بقول لك على الكورسات اللي خاصه بالام ار سي اس. انت شايف الصوره دي؟
Vascular communication skills trainer, Vascular history taking,
trainer,
واناتومي trainer, وباثولوجي
surgical anatomy
trainer,
trainer, surgical pathology trainer, ATLS course trainer, CRISP course trainer,
وجنرال trainer,
نعم،
وMRCS general trainer.
وفي جنرال ترينر. وانا ضفت عليهم تاني حاجه اسمها فاساي بريدكشن تول. فاساي بريدكشن تول اللي هي بتحط فيه الامتحان اللي انت داخله، بتقول لك من الماشين ليرنينج what station most likely to come.
حلو، بس هي المشكلة دي دلوقتي ازاي اطلعها من البوست مكتوبة كده haphazardly، مش عارف هي مترتبة ازاي.
مفيش حاجة اسمها هبهزر دي حبيبي، دي عبارة عن لينك. أنا هقول لك على حاجة، أطلع لك اللينك بتاعتها، هوري لك how simple it is. Okay, now here I will go to my AI studio. Okay, AI studio application. هو اعملها لك ان انت على اليوتيوب، انا يوتيوب اهو، ودخلت
انا
في
يوتيوب
البوست. اوكي، ادي البوست، ده البوست تاني about link congress. here is this is كمية a lot of books، 50 جيجا بايت of books على الام ار سي اس. and let us see here it is Vasai surgical pathology، وادي اللينك. بعد كده MRCS candidate grade tool training for MRCS candidates. وهنا
مكتوب
another vascular training for MRCS link. اوكي، هنا انا فهمت قصدك، انت عايز
مش
اللينك دي
مكتوبين،
بتاع برنامج ايه؟
اللينك بتاعت ايه وده بتاع
قوي
ايه وده
سهلة،
بتاع ايه.
هقول لك على حاجة. I will send you العنوان بتاع كل MRCS النهارده، لكن what you can do you press on it. easy. Once you press on it, the first screen continue app, allow microphone access, it's a history taking trainer. العنوان مكتوب فوق.
ماشي.
خلاص.
احنا
So if you are in a station and you are a member, okay, I'm not sure what is this link. Okay, I'm not sure what it is. I click it. Once you click it, it will open, continue the app, allow microphone. It is MRCS Part B General Trainer.
انا في
Does
حاجات
this,
فتحتها
does
دلوقتي
this answer
بس
your
ما
question؟
ظهرتليش.
ما هو ما ظهرتلكش
answer
لأن you need إن أنت يبقى logged in with your Gmail and your Google Drive have access to AI Studio. ادي اهو candidate، بتدخل اسمك مثلا 111، أو بتدخل GMC نمبر 123، تقول انا عايز امتحن نفسي في بيدياتريك سيرجري ولا فاسكر، كل ده MRCS يورولوجي كوميونيكيشن سكيلز. ادوست كوميونيكيشن، كرييت بورد بروفايل، تعمل لك بروفايل وتقول لك انهي ستيشن انت عايزها، وبيجن ذا ستيشن، وتعمل لك assessment to your performance.
حلو.
Okay, you select any station, and if you have Google Drive and Gmail, you shouldn't have a problem at all.
I have a Google Drive already.
Okay, very good.
A last question, if there is any troubles, how to contact with حضرتك يعني؟
Easy. Send me a message on YouTube. وليه انا اقول لك على حاجه. This is my number 0100 144 6456. Because وده my phone number and everyone is welcome. My phone number. لأن
كلكم معلش
كلكم أولادي. أنا كتبته على الشات.
ده المصري. اوكي.
0100 144 6 456.
اوكي يا دكتور.
تمام كده؟
Thank you very much for يعني spending more time with you يعني يا دكتور. و we are good lecture صراحة، واحنا we are hoping ان احنا يبقى في advance المرة الجاية ان شاء الله.
أكيد. المرة الجاية عايز كل مستواكم بيرفكت، والبرامج دي معمولة عشان تخلي أدائكم بيرفكت. Thank you very much. I wish you all the best.
Thank you very much.
Okay.